And what I found was that these people really didn't have a disorder. We had been asking the wrong questions for decades. For instance, if you ask a person with ADHD, look back over your entire life, dredge up all the memories you can. If you've been able to get engaged and stay engaged with literally any task of your life, have you ever found anything you could not do? That sort of shocks people. They never thought of it in that way. Well, thus far, 100% of my ADHD adults will think about it for a while and go, no, if I can ever get started and stick with something, I can do anything. Well, immediately, that means it's not a disorder. Some people who are, and the term is out in the literature, who are omnipotential, they literally can do anything, do not have a disorder.
Welcome to Erase PTSD Now, the podcast, erasing the silence. Here we bring trauma out of the shadows and into the conversation. You'll hear real stories, survivors, veterans, clinicians, researchers. Together we'll explore the healing treatment and the science behind the stellate ganglion block. This isn't just another podcast. It's a movement, and one that demystifies trauma, elevates unheard voices, and inspires action.
Today, I'm joined by Dr. Bill Dodson, one of the world's leading experts on adult ADHD, a board-certified psychiatrist with more than 30 years specializing in ADHD. Dr. Dodson has helped shape how clinicians understand and treat the condition. He's authored more than 120 articles and book chapters, was inducted into the Chad Hall of Fame, and continues to educate both professionals and the public about evolving science of ADHD. Dr. Dodson, thank you so much for joining us today.
Well, thank you so much for inviting me. I appreciate that.
So you spent more than 3 decades studying and treating ADHD. How's our understanding changed since you first entered the field, and what do you think people are still getting wrong about it today?
Everything has changed. It's hard to know where to start. For instance, the field has been sort of paralyzed for the last 25 years. We have not been able to develop diagnostic criteria for adults. We have not been able to develop diagnostic criteria for women at any age. Girls, women, pregnancy, postmenopause, zero. It's been ignored. We don't have a methodology to fine-tune the medication. You talk to people with ADHD, and a medication hasn't been well fine-tuned, they complain bitterly about it, and they don't stick with it. 80% of people go through an expensive evaluation and fill at least one prescription. 80% of people are not taking medication at the end of the year. 80% failure rate. So it's pretty bad. The biggest thing that's changed, though, and one of the reasons why we can't get diagnostic criteria, is the diagnostic criteria only describe children between the ages of 6 and 12. That's it. They've never been research validated in a group over the age of 16. So they just don't apply. And it's not that ADHD changed. It's that we change. ADHD is pretty much stable all the way through life. Everything stays the same except us. And so what happens is that in mid-adolescence, the hyperactivity, which was the only thing that anybody, basically it was the one thing nobody could miss and everybody could agree on, it dims down. It doesn't go away. It goes internally and is experienced as kind of a constant hyperarousal. And so that's where this crazy notion that people outgrew ADHD. It was nonsense then, it's nonsense now. Can you name another genetic disorder? Can you name another neurological disorder that goes away with time? There isn't one. So why would they think ADHD would? And it was wishful thinking. So one of the things that I've been doing is listening to my own patients and trying to come up with the things that everybody with ADHD had and nobody who didn't have ADHD. And so this is, 30 years worth of listening to people. And what I found was that these people really didn't have a disorder. We had been asking the wrong questions for decades. For instance, if you ask a person with ADHD, look back over your entire life, dredge up all the memories you can. if you've been able to get engaged and stay engaged with literally any task of your life, have you ever found anything you could not do? That sort of shocks people. They never thought of it in that way. Well, thus far, 100% of ADHD adults will think about it for a while and go, no, if I can ever get started and stick with something, I can do anything. Well, immediately, that means it's not a disorder. Some people who are, and the term is out in the literature, who are omnipotential, they literally can do anything, do not have a disorder. And in modern terms, they do not have an executive function deficit, because what matters is the situation the person's in. They're not in and of themselves defective or damaged, which is how the field has looked at them for 75 years. So we started asking different questions. With the dominant nervous system, the neurotypical nervous system, is about 90% of the population. About 10% of people are ADHD and or neurodivergent. And so the neurotypical nervous system runs on two things. It's important, and there's a reward for doing it or a consequence if I don't do it. Again, ask a person with ADHD, look back over your life. Can you remember even one time in your life in which the importance of the task ever once helped you in the slightest? Or has the importance of the task just been a nag? 100% of people will go, oh, God, it's just a nag. I can't stand it. It takes all the fun out of things. I procrastinate. And it doesn't help. Well, how do you get in the zone? How do you get to your abilities? Turns out 5 ways, and they're all related. The big one is interest. If a person with ADHD is interested in what they're doing, it comes easily. And this is why it baffles parents and teachers, because sometimes the kid can, get engaged and stay engaged with a computer game or something like that. And then when they lose interest, they're often well out. And so it's the swinging from being totally engaged to totally disengaged that baffles everybody. Second way they get engaged is competition or competitiveness. If somebody says, oh, you can't do that, if the person's response is, oh, yeah, watch me, whatever it was, they'll have that thing mastered by the end of the day. Doesn't matter what it was. Third thing is novelty. And under this, we put problem solving. People with ADHD are marvelous, out-of-the-box, intuitive problem solvers. And you think about what we pay for out in the world of work. It's the guy who can figure out the solution to a problem and has stumped everybody else. We don't pay the big bucks to the grunt who goes out and implements that idea. So if you can just get people with the ADHD out of their way, they blossom, especially in business world. Fourth one is urgency. Right at the door to high deadline, and a college student is blown off the course the entire semester. The night before the final exam, can get in the zone, do the whole course in one night. In order to turn out a paper that's very high quality. Trouble is, they're blown away for the next 2 days. They just burnt to a cinder. It's a hard way to live. The fifth one is the rarest one, but the best one, and that is the fifth way of getting in the zone is to have passion for what you're doing. It gives meaning and purpose to your life. It means that when you get up in the morning, you can't wait to go do whatever this is. It's rare. Not rare. It's uncommon. About a fourth of people are able to have something like that in their lives. So we use an acronym, ICNUP, ICNUP. Interest, challenge, novelty, urgency, passion. And those 5 ways, you sort of develop only those 5 ways, a person can get engaged with the topic, get access to all of their tremendous abilities, and then stick with the task all the way to the payoff. It's a matter of engagement. So what this means is that ADHD is not a disorder. It's a second nervous system that works perfectly well, but by its own set of rules. And the set of rules that work for neurotypical people don't work at all for ADHD people. which is why school is a horror show for most people with ADHD. Mostly people with ADHD are smarter than the general population. The average IQ is 125. So all the intellectual firepower they'll ever need is sort of built in. And they're great problem solvers. They find compensations to get around the impairments of their ADHD. Now, the topic today is post-traumatic stress disorder and the fact that the two look a lot alike. They share 14 features in common in the DSM. So it's a three-part question. Is it ADHD? Is it PTSD or complex PTSD? Or have you won the negative lottery and you have both? It's really hard to tell.
So, Dr. Dodson, I do want to jump in and ask you something, though, real quick, just for basic understanding, because this is very interesting, and I imagine that a lot of people can relate to this. We have a lot of adults wondering why they think they have ADHD now, and it wasn't caught when they were kids, or they might recognize some of these some of the different things you just described. So let me ask you about the H. Can you explain what the H means, though, before we get into the other components?
Well, originally it was hyperactivity.
Right.
These kids were just peeing off the walls, uncontrollable. And in fact, ADHD was originally identified in kids with hyperactivity was so severe they were hospitalized. And the thing is that as people grow up and they get better ways of controlling themselves, that hyperactivity dims down out in the world, but it doesn't go away, it turns inside. Again, it's always important to ask the right question. If you ask a person with ADHD, at any given moment, how many completely separate, independent lines of thought do you have going on in your head at the same time? Most people will say at least 3. Most people, it's 5 or more. So that in and of itself is distracting. Imagine sitting there where you are right now and having 5 people talking to you on different subjects, trying to get your attention. It would be maddening. And that's what a person with ADHD experience every moment of their lives. So it's that internal system of just kind of boiling, always going, never resting. And people struggle to find words to describe it. And unfortunately, they use, Doctor, I'm anxious. Again, because it's so tense and can't slow down. And again, they're using a label that misdirects the clinician. ADHD is not taught in medical school and residencies. Half of pediatricians admit they do not think that they're competent to handle even an uncomplicated case of ADHD. 93% of adult psychiatry residencies do not mention ADHD in 4 years of training, even though 1 in every 5 patients that psychiatrists will see will have ADHD. It's virtually always missed. In my practice, 95% of the people who walked in the door to see me were self-diagnosed. They figured it out. What happened is because it's so genetic, they're sitting with a family member, and she said, "Gee, Fred, your life has just really changed for the better lately. What happened?" And he said, "Well, I got diagnosed with ADHD, started on medication, made all the difference in the world." And they start talking, and my patient goes, "Wow, that's me." So what happens is, of course, they try their cousin's medication, and they see that it worked. And so that's 95% of my patients. Somebody will come in, and they'll think that I'm going to be mad at them for having tried their family member's medication. I want to tell them is, look, I can't get mad at you. Every teacher you ever had failed you. Every doctor you ever had failed you. You figured it out on your own. And when you found out the medication worked, you did the right thing by coming in, you're getting an evaluation, getting your own prescription. Could you have done anything else but what you did? I admire him. I don't do it again, but I admire you for not giving up and haven't figured it out on your own. So, right now, the average age of diagnosis of ADHD in the United States is 31. That means half of people get diagnosed after they're fully into adult life. They've been through school, been in the world of work, they've started families. And what happens is that life just gets progressively harder, and they finally just can't compensate for it anymore. And that's why they seem to suddenly become symptomatic. A lot of times, it's not that they found compensations, is that they discover what they could not do, and so they stop doing it. They just go, well, really don't fit in our school system, so I'm going to drop out of school. I'm not going to go on to college or whatever. And so while they're not failing anymore, it's also their lives have been limited. The way that ADHD and PTSD overlap is that people with PTSD are always trying to find a way around that internal arousal that had a protective purpose. I mean, they saved their lives. PTSD, one of the differences is ADHD is clearly genetic. It's there for conception. It's there all the time. Everywhere you go, it's pretty constant. It's the screen against which an ADHD person's life is played out. PTSD is something that happens to you. You're going on, you're a normal person, and some sort of trauma that is beyond your ability to handle happens, and your body becomes hyper alert. And so it's always trying to deal with this hyperarousal, and either they're hyper vigilant, and so they're not really paying attention to what the teacher says, they're looking for what's going to get them. Or on the flip side, they dissociate. They're off in la la land, just trying to stop that fear of death. And so they look inattentive. And the trouble is, they're paying attention to something. They're paying attention to the possible recurrence of this deadly trauma that they experienced before. Historically, PTSD is very narrow. There had to be a single traumatic incident, fear of death, of serious injury. It was always in adults, usually adults who had already developed their sense of self and adult coping skills. And when you looked at people who had been exposed to severe trauma, only about 6% ever actually developed PTSD. 94% of people, it was a bad time, they get over it and they go on with their life. Also, women have PTSD, the full-blown diagnosis, twice as often as men do. Women lead a vulnerable life. Almost always the trauma is intimate partner violence. It happens within that relationship, which produces yet a whole new problem of the person you trust and love is the one who's trying to kill you, which is a problem all by itself. So it's because of the inattentiveness, what looks from the outside like inattentiveness is really just paying attention to what is emotionally going on inside. So the people with ADHD will have PTSD about twice as often, somewhere around 12% rather than 6%. So there are some studies that showed up at about 38%. So people with ADHD have PTSD much more frequently, much more severely.
So let me just go back to one thing that you were talking about. I didn't want to interrupt that at all, but I think I heard you say, can you explain the fear of death that you're referring to?
The traditional diagnosis was that the person had to be exposed to a traumatic incident in which the person believed that they were going to either be terribly injured or probably killed. And that so warped what was going on that they never stopped responding to that deadly threat.
Okay.
Now, who developed PTSD versus who didn't, oddly enough, seems to have a great deal about what the person believed about that traumatic incident. Imagine two soldiers in a foxhole, and they're in a terrible jam. They truly believe that, we're done for, we're going to die. Certainly have that big chance. The guy who develops PTSD says, I am in mortal danger. There's nothing I can do to save my life. I am just going to die traumatically, painful. The guy right next to him going through the same thing says, I am in mortal peril, but there's got to be something I can do to get myself out of this problem. I can survive this and do well. That guy comes out of the whole thing stronger because he met death, overwhelmed it, comes out feeling better. Guy next to him who believed it was going to get him comes out permanently damaged. And it was the belief that the person had about the event. So it's just having trauma doesn't predestine you to having PTSD. In the last, 10, 15 years, we've come up with the realization that it doesn't have to be just one event. That you can have complex PTSD from multiple small injuries, neglect, a lot of stuff that goes all the way back to childhood. And again, where the danger comes from the people that the child most depends on for safety, the parents. So we're talking about kids who are repeatedly exposed to abuse, physical, sexual, emotional abuse. The place where people with ADHD overlap with that is the constant message that they get from the rest of the world. And that is, there's something wrong with you. What's the matter with you? Stop that. Don't do that. Try harder. And of course, they just says it's failure. And so they get this constant feedback that who and what they are is wrong, is damaged, and definitely not wanted. You better, pull yourself together and perform the way I expect you. And so they get these thousands of messages of you are wrong, deficit, damaged, and I don't want you. I don't desire who you really are. That's why they get those thousands of rejections. There's an article by Michael Jelinek, who at the time was the head of child psychiatry at Harvard, and he estimated that by the third grade, the average kid with ADHD hears 20,000 additional negative or corrective messages by the time you're in the third grade in school alone. I don't care who you are. 20,000, sit down, stop that, pay attention. Come sit in front of the class. All of a sudden, you're constantly getting the message, you're wrong, you're deficit, you're wrong. Another study by Mikami, looking at that same age group, third grade, found that 70% of kids with ADHD did not have a single friend. Their inability to control their emotions, their aggression in play and things like that have alienated every other kid on the playground. So there they are, 8 years old, and never invited for a play date, never invited for a birthday party. So they come in with this notion of nobody wants me the way I am. And so it's that constant rejection of kids with ADHD that when it gets to be adults, they have this profound sense of, I'm damaged, I'm wrong, nobody wants me. To make that worse, just about everybody with ADHD magnifies that with rejection sensitive dysphoria. It's a real tongue twisting name. Well, just to find out the question again, I always work from this. Look back over your entire life. If you, have you always been much more sensitive than other people you know to rejection, teasing, criticism, or your own perception that you failed or fallen short? Thus far, with my patient population, 95% of people have not only checked that positive, they've underlined it. This is my major problem. It's a major deal with people that you see, and the emerging research is that, if you use a strict definition of RSD, is only found in people with ADHD. Or ADHD, it's not, I mean, everybody gets criticized and rejected. Nobody likes it. But for people with ADHD, it is devastating. When they perceive that it happens to them, they can't function anymore. And they just fall apart, or they externalize it in a rage at the person or situation that wounded them so severely. So they get double the problem. And so what we have is people, children, either who are being neglected, abused, whatever, and it over and over and over, or people with ADHD who are being rejected for who they are and not given any help. All this came from the point that the person had to grow up and figure it out on their own, especially women. When I was in my residency, I was told that women did not have ADHD. Again, which is utter nonsense then and now. Half of people with ADHD are female, the ratio 1-to-1. Women get ADHD just as often as men, but they're not hyperactive. They're not obnoxious the way boys are. They're usually well socialized, but at the same time, still suffering that constant injury of who I am is wrong and unwanted. So by the time you get an adult, that person is doing their very dead level best to hide very poor self-esteem, huge issues of shame, just the way people with PTSD are. Well, there's tremendous overlap. And it's sort of the same way that multiple constant daily trauma ultimately having a profound effect on who the adult is and the quality of their life.
So, okay, so you're just bringing up so many things that I believe that probably a lot of people are asking themselves or thinking about other people analyzing what you're saying. So you said the shame is overwhelming, which was a common denominator with substance abuse and everything else. So will you talk about the shame component for a minute?
Wow, I have a 1-hour presentation on that. Let's see if we can put it in 10 seconds. What do you say?
Of course, I know. Every part of this is something we could delve into so much deeper, but it's so fascinating because it's all part of the recovery journey for everything. So
Yes.
you're a wealth of information. We're so lucky to have you here. Thank you.
I'll start off with what the difference is between guilt and shame. Guilt, I feel terrible about something I have done. Shame is I feel terrible about who I think I am. And I feel so terrible that I hide who I am from other people. I do not lead an authentic life. I wear a mask. I put forward to the world what I think the world wants me to be. And so I change myself. I hide myself from others so that I will fit in. What I don't do is find a place where I do fit in so I can be authentic and genuine. So shame, I'll go all the way back to Sigmund Freud. Freud called it the master emotion because it has two features. One is it's the only emotion that doesn't seek expression. It's hidden. A person will not tell you what they're ashamed of. And the other thing is that it governs the expression of all other emotions. So that it's sort of the Professor Moriarty of the brain. It's always lurking in the back there and controlling what goes on and how a person perceives the world, how they are perceived, but it remains hidden. And so there are basically 3 phases to the treatment of any adult with ADHD. One is you level the neurologic playing field with the medications. Make sure that the person has as much available to the work as possible. Otherwise, they'll end up failing like they failed high school. Second piece is to learn that second nervous system. How does my brain really work? Learn how to master that. and get access to my abilities and be omnipotent. The third part, and that's the hardest one, is then to come back and revisit your entire life as an adult, not as a child, but as an adult, and see how you got this self-concept of I am bad, I am broken, I am damaged, nobody will want me as I am. So I have to hide who I am. I'm ashamed of who I am. And that, of course, shares with everything in life. So that story is long, protracted. It takes a year or two to really handle all this stuff. But that's how a person really gets back into life. Doing ADHD work is the most rewarding thing you can do in medicine. With everywhere else in medicine, we're trying to get somebody back to where they were, help them function the way they were doing it. In ADHD, the outcome virtually always is that the person's doing much better than they ever have. They are what we call the best version of themselves. So the payoff for doing ADHD work is tremendous. Treatment, as you well know, of PTSD has nothing to do with medications. We don't have a medication that really helps PTSD because it has a totally different source. It has nothing biochemically wrong with the person. It's just they're doing their dead level best, dead being awkward word, to try and deal with more stress than certainly a child can handle. And so consequently, the things that do help PTSD are what we call somatic therapies, in particular EMDR. That's something I refer to people to all the time. A lot of cognitive behavioral stuff. But again, it's trying to get that autonomic fight, flight, freeze response back under conscious control. So the treatments for PTSD, especially complex PTSD and ADHD in adulthood, overlap a great deal because ultimately both of them have to deal with that early repetitive injury and pain. But they look alike, they end up in the same place, but they're totally different in terms of what causes them. So if you're an unlucky person who has both, you have to do both. There. You can't do just one.
My gosh, I could keep talking to you forever. I mean, you keep bringing up some points that are so worth discussion. But
Yeah, ask
I'm
me
gonna,
back.
yeah, we're gonna have to ask you back for sure. So thank you again for your time. Um, you're and sharing your decades of knowledge and experience with us. For many listeners navigating trauma and emotion alongside ADHD, I hope this conversation offers both clarity and hope. There's so much information to digest. Thanks again for joining us.
Thank you for listening to Erase PTSD Now, the podcast. If you've been affected by trauma, love someone who has, or want to be a part of real change, this space is for you. New episodes drop every third Wednesday. Follow Erase PTSD Now so you never miss an episode, and join us in the fight to erase PTSD.